The natural sciences, a field that started from Western philosophy, fueled by humans' innate desire to know more about the world that we are living in. From the wonders of Mother Nature, the numerous cells that living organisms are made of, to the unknown secrets of ourselves, the wonders of this machine that we are living in, human anatomy, natural science is inseparable from the wonders of this world. Hi, I'm Talia.
And I'm Joshua.
And welcome to our podcast, The Uncommon Senses, where we discuss the nature of knowledge and on how we know what we claim to know. So, welcome to our special series of interviews, where we discuss different areas of knowledge with our guests. Today we have Jasmine Chan and Jasmine Poon, and they are university students from the Chinese University of Hong Kong and Bristol University, pursuing majors in medicine and veterinary science. So, Jasmine and JP, tell us a little bit more about your major and perhaps share a bit on your university lives. What specifically are studying, the program you're enrolled in, and for JP, your experiences on living in the university and living abroad, etc. Yep.
Hi everyone, I'm Jasmine Chan and I'm currently studying medicine in CUHK. And I think that is really fun because for year one, we just kind of learn more about biology and chemistry. And it is more of like the basics from IB and just a little bit more deeper into the subjects. And currently I've studied about anatomy and also health sciences and also other core subjects such as physical education and Chinese society and also some kind of subjects related to philosophy. Yeah, and so far I find it really relaxing with a very low workload, and I just kind of mainly focus on my society where we help children to get more health education about like washing hands and brushing teeth. Yeah, so that's pretty much it.
Hey, I'm Jasmine Poon, and I'm studying veterinary science at the University of Bristol. And in our first year, we basically have the main modules animal management, which is all the animal handling things, and then we had professional studies, which is to continue our professional development and all of that. And it has been there are a lot of information for us to learn, but then it's still it's quite relaxing, and it's also been pretty cool living in a different country and all that. It's a lot less city like than Hong Kong. It's like a small town vibe almost, and it's quite relaxing to be. It's not as noisy, and you get a lot of like green grass and trees and everything. So it's been really nice.
Nice cottage core.
Thank you for your awesome introductions. And, let's just jump straight into some theory of knowledge questions on the natural sciences. So especially on biology and chemistry. And also most of these questions are obtained from the website IB Mastery. So a lot of thanks to them. So my first question to you guys is that, is language necessary for the construction of knowledge in the natural sciences? So as we know in biology or anatomy, there are a lot of very specific jargons and terminology used, and sometimes it's quite hard to remember. So to what extent do you think these perhaps like Latin names and these terminologies are useful or detrimental to the pursuit of knowledge in these areas?
So for medicine, I think that language is, of course, very important for the construction of knowledge because, like, when a doctor communicates to the patient, it kind of helps the patient construct knowledge about his or her own symptoms by themselves. And then sometimes the patient may actually don't really know what's happening. Maybe he would just think that his fingers are very painful, so that the doctor need to ask a lot of questions using layman terms. And I think that it will help the patient construct knowledge. And I also think that language is very important in research, like in the medical field. And currently, I'm helping out in a rheumatology department where they are studying 6 years of data of different patients. And I think that it would be very hard to actually construct knowledge or gain knowledge from these numbers because they have like 6 years of data. So I think language is very important because it kind of organizes everything and turns everything into a readable essay. And also for my own studies, I think that language is important because different symptoms or like medications, they are named in a certain way so that it gives it meaning. So definitely important. However, I also think that other parts are also important, such as like visuals. Because for example, after my exams, I actually forget a lot of the content, but then I kind of remember most of the diagrams, although I have forgot the words on them already, but then I can still kind of remember how the theory and the logic works. So yeah, the conclusion for me is that language is definitely necessary. However, there is also other parts that are required in the construction of knowledge.
I totally agree with that as well. I think that yeah, it's definitely important when you're trying to communicate with your teammates or anyone else to create a sort of shared knowledge between each other using the language. And like you said, a lot of the times names have meanings as well, like the prefixes and suffixes. Like they're very useful in helping you guide what that knowledge means. But I think definitely maybe a downside would be we have so many different languages, so people will use different words for like the same things, and that is like sometimes you would get a bit confused from that. Like which term should you use that is correct when both of them are technically talking about the same thing? Yeah, it does get confusing.
Yeah. From your response, we can see that I think knowledge and language has a very important role in facilitating the communication and spread of knowledge. But I think you guys also mentioned a lot of how facilitated your construction of very specific and very specialized knowledge. So do you think, to what extent do you think language can also perhaps segregate commoners from these professional knowledge? So to what extent does it post a barricade for them to access certain fields of knowledge?
I think that it's very certain that language will actually segregate commoners from professional doctors. And I think that's why we need to really know, like doctors really need to know how to merge these professional knowledge with the patient's language. And I have some examples. For example, in my internship, doctors, they perhaps need to ask the patient, like, what pills are you taking right now? Because they need to take history and they need to further understand how to give the best treatments to the patients. And most of the times, the patient can actually, they will forget the name of the medication, or they're not able to say it out loud, except, especially for elderlies. So sometimes doctors will just ask the patient, what kind of shape is your medication? Like, is it a triangle or a circle? And what color is it? And sometimes they can actually know what pills they're taking through these questions. And also, sometimes before seeing the doctors, the patients will need to have a survey about how painful are their fingers or toes, and they may actually not know the professional terms, so they would just assess it according to how the redness of their fingers and toes and the level of pain. And then the doctors, they will change that knowledge and calculate a certain number, which gives value for the symptoms, and also kind of let them to give the best treatment to the patients. And also another experience type of thing is like the XCT machine, which allows the doctor to know more about the situation of the patient. But then a lot of patients does not know what this is, and sometimes they may refuse this screening. So the doctors just need to tell them like, oh, do you remember the XCT machine? And sometimes the patient would say no, and then the doctors would say, oh, it is the machine where you put your hand inside and you need to stay for a very long period of time and with towels around your hand, and the patient would be like, oh, I remember that. Yeah. So I think that, yeah, definitely language will segregate commoners from professional doctors, but then like doctors need to kind of like bridge the gap. Yeah.
That's very intriguing. So do you think it's like a limitation, or do you think it's actually, necessary that language segregates, commoners from these really specified knowledge?
I think that it is necessary because there is a lot of information from the doctors that, like, if they talk about those terms, then the patient would not understand it. But then the doctors will need those terms to actually kind of have a better understanding of the entire situation. So yeah, I think that the segregation is important. Yeah.
I see. So, Jasmine, Poon, do you share a similar view, or do you have like an opposing viewpoint?
I actually entirely agree with Jasmine here, because it is when we have professional terms that makes communication with professionals much more efficient, because your words are more specific and targeting to the exact case that you're trying to mention. So that would be so these professional terms are really helpful for us. But at the same time, yes, we have to be aware that clients don't have to be required to learn all these terms. So then we have to make sure that they understand it in their common terms and to explain to them. And yeah, so it's something to be aware of definitely when we come into practice, but at the same time, these terms are pretty essential for professionals.
I also agree with the fact that I do believe that like there is a need for segregation because like from me my direct experience is doctors when they prescribe me things they write so messily I have no idea what they're writing, and perhaps before I would think, well, that's kind of mean, right? Like you're just deliberately not letting me know what you're writing. But then I realized like it is important because it can easily be used by someone else to prescribe themselves like and diagnose themselves with things that they're not. So I think when it comes to like anything related to the medicine, I do think there is a need for you to, segregate between someone that has professional knowledge and is able to give you proper diagnosis, or else it might be exploited or used by someone that lacks that ability.
Yeah, for me, I actually hold a slightly different viewpoint. I think, while it is a necessity, I think we also need, as Jasmine Chan has said, we also need that gap to really allow commoners to access these really specific terminologies. And I think um, even though specific terminologies can allow people to communicate smoothly without a very niche community, I do think that sometimes it could pose like perhaps a restriction to people's understanding if terminologies are too specific, or they're too their understanding is only restricted to a certain community. So personally, I still feel like there is like it does create a disparity in education and knowledge. But yeah, I think as long as there's like a smooth communication between the communicator and the people listening to the terms, I think it's fine to have this segregation. So with a similar question as before, as we know, labels are a necessity in the organization of knowledge, but they may also constrain our understanding in some sense. So, as we know, language labels are very important to label different types of body parts, histology names, and so on. So, a similar question: to what extent do you think these labeling these different, perhaps different entities in natural sciences restrain knowledge, or do they, as mentioned before, do they allow the facilitation and communication of these knowledge?
I think that for me, it is a funny thing because I also wrote for this label question for my TOK essay. And I think that labels is really important because in medicine, we need to label different body parts and different cell types. And in histology, we need have a lot of similar structures. Like when you look at the screen, they're all like pink and purple, and you just see like pink and purple in every slide. But then the way we differentiate is by the structures inside it and also like the structures around the cells. So sometimes the difference is just that some cells are slightly bigger and rounder, and it is pretty hard to see. So by labeling them and seeing a lot of the same type of labeled cell, it actually helps us to identify the cell type. And I think that that's very important. And for studying histology and for getting it kind of like a good grade in it. And another point is like for anatomy, a lot of times we use like superior, posterior to talk about like if the organ is in the bottom part or on the top part, and also things like lateral, and it makes things easier to remember. However, I can also see how labels can be restricting because there will always be exceptions. For example, there are certain disease cells and they may not look like the other normal cells, and we may misidentify them. So I think that it is always important to learn about the exceptions. Yeah.
Yeah, I feel just the same about that as well, because labels are very important for us to like learn about the subject, because it helps us understand more about like different body parts, different like how you identify position of things and all of that. But at the same time, it's important to remember that there are cases where you have to think outside of the box. So like perhaps you have like a specific disease that we learned about, but there are cases when perhaps there like you will find different symptoms and during clinical exams, and different problems that may show up that are not the common ones. And so it's very important to, while not be too reliant on labels, even though they're really helpful for us to learn about the course and all that.
Yeah, so thank you for both of your response. I think you guys are able to really show us how language could both, facilitate and restrain our knowledge, and is of utmost importance when we're studying natural sciences, especially in terms of the academic sense. So moving on, let's talk about, ethics. So I know, studying both human and veterinary medicine requires one to have a very strong moral compass. After all, the lives of living creatures are in your hands. But obviously, this is a very subjective from subject to subject or even person to person, having been an area of contention in much of the scientific community. So I would like to ask, do you think scientists should have a moral compass? And especially in the sense of like animal testing. So do you think it's ethical and should it be permitted for the purposes of human benefits? I'm just curious about to see both of your response since you two work in very different fields despite it both being medicine, one being working with humans and the other working with animals. So I'm just very curious to see your different viewpoints on animal testing and using it as an example to see, does scientists really require a moral compass in doing all sorts of research and their work?
Yeah, ethics is a really big part of veterinary science, especially because we're formed on the basis of animal welfare. So we really, yeah, we really put a lot of focus on discussing about ethics, and um, it's a it's part of our profession, like part of being a professional, to at least have some ethic and moral responsibilities. But it's we learned that like some people have different views towards ethics, such as like utilitarianism or virtual theory. That different modes of different modes of ethics that people can take up. But the way that like veterinary science, like to in order to standardize this kind of ethical responsibility, we will put down regulations and laws and things like that. So for animal testing, we know that it dates back like a long time ago, and back then there aren't any rules and regulations. So from now there's it's in this day of age, a lot of things have been set up to make sure that animals have like we have minimized all the harm we do to animals. It's like things we learn in biology as well, like to reduce, refine, and replace. Like we learned that from biology to kind of make sure we're only using animals when we really need them. And some things that maybe more detailed that we learn in our course is this home office license that you will have to obtain if you are going to do any sort of harm towards an animal that it's more than just like putting in needles or like yeah the injection into an animal. And there are lots of protected animals as well, like companion animals, dogs and cats, horses, and even people are trying to argue right now that even lobsters and crabs shouldn't be harmed because they have they're sentient as well and consciousness. And I think that's a big thing we can discuss as well is consciousness of animals because um, how we decide what animals we can like test on, like what is like considered ethical. A lot of times we talk about consciousness, like if they feel pain, and that is like a big discussion because it's we can't measure that. It's impossible for us to know, and the only way we're doing it by now is how similar their brains are to humans, or like yeah, how they react and things like that. But yeah, there are a lot of rules to put in place and a lot of different guidelines to help guide vets to what research can be done and what research cannot be. Yeah.
Yeah, that's great to hear. I mean, you know, I completely agree with you. And it's good to see that how there are guidelines and there are, regulations set up to protect the rights of organisms, no matter from, dogs and cats or like animals that were considered are the most sentient, perhaps, I'm not sure if I used it correctly, or like to animals that we recently discovered may have like, certain pain receptors, making it unethical to also test on them. So yeah, I'm also so let's use an example. So in recent years there have been some medical breakthrough as to harvesting genetically modified pig hearts to save the lives of heart failure patients using organ transplant. So I'm just curious. Building on what you said, do you think this is ethical to really just create animals just for the sole purposes of like harvesting their organ and trying to provide the best care for human beings. Do human beings have the right to kind of manipulate and control these natural processes for their own selfish desires?
I feel like if we judge it from the fact that because when you do transplant and all of that, it's going to harm the animal and cause a lot of pain. And yeah, you can think about all of that, and their quality of life is really not that good because you're really just breeding them up, and you can imagine, um, yeah, like they won't have that like the best quality that like not when they could just be pigs living. So it could I think that in terms of animal welfare, it's not really a right thing to do. Like in my opinion, it's not like very ethical. It's like for example, even cat kidney transplants, like cats between cats, they are not allowed. But because you cannot do it on a live donor, especially because like yeah, it costs too much pain, it costs too much harm, and it's not yeah, it's not really worth it. And yeah, so it's not even allowed for kidney transplants to happen. So I don't think that yeah, doing it to pigs is like any better. And yeah.
Yeah. I mean that makes sense, right? What gives us the right to determine, what is what should be done with like the lives of other animals. After all, from a scientific viewpoint, humans are also a kind of animal in a sense.
Yeah.
So Jasmine
Yeah.
Chan, do you agree with what Jasmine Poon is saying? As a doctor, if you were tasked to really perform to really save a patient dying of a heart failure, would you agree to really take the heart of a pig to do the transplant?
Actually, I'm not very sure about this. But then, as a point of view, like just for myself, I think that if that person is actually dying, I will probably do that because I will feel like the person is like the life of that person is very important. And I'm not really into I don't really know much about like research in animals, but then like I've learned about research with humans. So like a lot of research includes human participants, and I do know that like there's this declaration of Helsinki where we kind of want to protect those participants' rights. And there are seven main requirements for like having patients or like people in ethical research, and it includes social and scientific value, the scientific validity, and also like the favorable risk benefit ratio. And I think like the very subject selections are also very important, as well as the independent review, informed consent, and also the respect for potential and enrolled subjects. So because currently I'm also like helping out in a research which includes human patients, and there's not big of a risk. It is just tracking out data, but then I also need to kind of hand out consent forms to them. So I think that like informed consent is very important. And yeah, that's pretty much it. And I think that these requirements should be keep on being updated, because like previously it has also been changed a lot of times, because like I think that as technology and also as our like as the general population is more and more educated, they will want to know more about like the research that they are participating in. Yeah, so that's mainly the information from me. Yeah.
Yeah, I think it's very interesting. There are two different viewpoints based on, two different subjects being studied. And, it really brings a lot of questions. Should there be a declaration of Helsinki for animals? Should they sign the consent form saying that I do not want to participate in animal testing? So, really leaves a lot of room for thoughts, I think. Yeah, and, moving on, I think we can also talk about, on the subject of ethics, I have some individual questions I would like to ask each of you in regards to your field of expertise. So, as both humans and animal doctors, they hold a substantial amount of power, and with great power comes great responsibility. In this case, ethical one. So, I would like to just to ask a series of questions targeting the extent of power of which a doctor could have over the life of a patient. So, let's start with you, Jasmine Chan. So, for the first question, like like to ask is something related to public health. So, in recently, there has been debates about vaccination and herd immunity. So, I would just like to ask, do you think one's personal freedom should be prioritized above the health of the public?
For me, I would think that one person, of course, both personal health and also like the public health is very important. And I think that like for herd immunity, well, from what I understand is it is that like a lot of people they are getting vaccinated, so it kind of protects the entire population. And I think that for vaccination, like autonomy can be very important if herd immunity is already achieved. So like if there's already enough people vaccinated, I don't think it is that much of a deal if you don't want to get vaccinated. But then, like, if herd immunity is still not achieved, I think that it is still very important for us as doctors to persuade patients to get vaccinated. However, like, it will be wrong if we force them to, because, like, the idea of autonomy is very important. And also because, like, for vaccines, if we only have a limited amount of vaccines, then the idea of justice will also be very important because limited resources should be allocated in a better way so that the people who actually want the vaccine can get it. Yeah. And for public health, what we have learned is that policymakers is kind of like more important than individuals, and the decisions they do is more important. So I think that rather than saying like doctors should force people to get vaccinated, I think that a better solution for herd immunity would be some policies. Yeah.
Yeah, that's very interesting. So you're saying, we should encourage the public to really be vaccinated and develop herd immunity, but we should also, value personal freedom and allow them to have the ultimate decision to, control their own faith. And let's, as all ethic questions. So let's push this to the extreme. So let's jump into another field, euthanasia. So given a similar situation, if a patient is nearly dying but wants to live, should he or she be euthanized, given that, even if it's draining resources from patients that may have a larger chance of survival? Do you think, the patient should be put down, or do you think the patient should, still be kept alive since that's what he or she wants?
I think that for euthanasia, I think that like of course like if it is actually happening in real life, I think it is illegal in Hong Kong, so I just won't do it at all. But then like if given the case that like this is happening, I think that perhaps I would kind of like need to evaluate this with the team. And I think that I would definitely kind of like understand the idea of autonomy, and I think I would try to give euthanasia to this particular patient. And of course, there will be other patients who will actually have a smaller chance of survival. Yeah, but then I will also need to look at other aspects, such as like, do they actually want this or not, or maybe like they want to live for a longer period of time. So like, I think there will be a lot of things to assess before I make this decision. Yeah.
Mm.
Mm.
Yes, thank you for your response. So, there is a lot of different considerations regarding, euthanasia and which patients to save. And, these are questions that's long been, questions that um, are asked, and perhaps, when you're trying to apply for medicine in university, when they ask you not ethical questions, since it has been an area of much contention. So, Jasmine Poon, so, on the same area of in euthanasia. So, in veterinary medicine, not a lot of times as a field trip veterinarian, you may be facing a problem. So if the owners of a pet is not able to afford treatment for a sick animal, does then give them the right to euthanize said animal? Because in the law it does say they are allowed to do that. But personally, do you think that should be the case?
Um, Honestly, like as you said that we have great power, the truth is that we cater, like as general practice veterinarians, we cater to the client. So whatever we do, the client must have consent from the client, and it must be the client's decision. The most we can do is encourage them, persuade them, make them understand. But when it comes to things like money problems, it is a huge problem, and that is why vets are always trying to advocate to teach the public that if you don't have the necessary money and um, assets to take care of an animal, you shouldn't get one. And that's because in the end of the day, it is the client's decision. And as much as it sometimes is painful to see that an animal could have a chance of living, but it might be because the client does not have enough money or something, and then you have to euthanize the animal. That is a very common case, and it is quite sad, and it's quite out of our hands when it comes to that kind of problem. Yeah.
Ah, I see. So there is like a focus on the client's consent on whether, they are able to afford said treatment. Otherwise, the animal will have to be euthanized. So, speaking of, the rights of a client to determine the fate of their animals, do you support like, crossbreeding pets or, to kind of genetically modifying pets so they have, stronger chances of survival or to widen their biodiversity? Do you think humans have the rights to kind of alter one's genetic formulation against perhaps the choice of nature or like the natural processes?
I'm not like a big fan of genetically modifying. There are lots of perhaps like controversies or different opinions, but I think in my own perspective, I believe that because a lot like the natural process happens through like which like the survival trait is always the one that's most beneficial. So when you crossbreed things like that, you have, for example, brachycephalic dogs. That is like a very big topic for like a lot of years, and that's basically the fact that these dogs aren't actually like meant to be like this. They're not meant to have such short snouts because that causes so many breathing problems, and that has caused a lot of like detrimental animal welfare to their lives because so many dogs are having heat stroke, so many dogs have respiratory issues that the client might not have the money to treat or things like that, and it's really yeah, it's quite sad to see. And yeah, personally, I think that it's always best to cater to the dogs, like to the animal welfare, rather than what the public enjoys, like what the public likes in their aesthetic. So yeah, I'm not the biggest fan of like genetically modifying or doing anything that's not per se natural.
Yeah, I really like that mindset to, to treat animals like we should really treat animals like a person, and their comfort should be their utmost priority, and it's our responsibility to make sure that they are comfortable and they have the best life they have. So yeah, lastly, I would just like to ask one last question. So with the advancement of technology, AI has been increasingly used in both human and animal medicine to reduce human errors and to increase efficiency. So to what extent do you think AI should be allowed to to be involved in the works of doctors? And do you think at some point, do you think AI would be able to perhaps replace the works of physicians or veterinarians?
I think that if AIs in terms of just technology and equipment, it has been really helpful, like the development of these technologies such as like endoscopies and gastroscopes, because you can have like minimal incisions, minimal invasiveness, and that will really benefit the animal in terms of how much pain you're causing it and how fast they like recover from it. And so these technologies definitely very helpful. But when you say to what extent, thinking maybe far off in the future, maybe there's some kind of robotic veterinarians doing the procedures, and I think that would be not very good because then you don't really have someone who's accountable for it, someone who's responsible and in control of the procedure and what they're doing, and it can cause a lot of friction between clients' trust towards the vets if we turn it into like a robotic industry because yeah, you don't have anyone to hold accountable anymore. And like, what if the robot fails or something like that? Like, yeah, it will kind of break that client and vet relationship, which will then obviously decline the use of vets in the world, and then animal welfare could drop easily from that.
So Jasmine Chan, do you share the same sentiment?
Yeah, I think I share this sentiment because, of course, using AIs in surgery will be very helpful because we will always have human error, and sometimes it can result in really bad damage and like really serious consequences. However, I think that AI like it cannot replace humans, and like it cannot replace physicians, because a main part of being a doctor is more of communication. And sometimes like we need to kind of like talk about like the good sides and also like the side effects of some drugs. And I think that AI will not be able to do that. And also like, for example, breaking bad news and also like giving emotional response. So I think that doctors are also very important. And although I have no experience with AI in surgery, I do see how like we can use tools for tying up like a wound in surgery, or also we can use a hand tie. Although when using a two tie, it is much more easier, and it will be much more prettier and easier to manage. However, there are some places where you cannot tie the string using a tool, so we need to use your own hands. So I think for now, AI can not completely replace humans, and also like physicians are also very important in surgery. And also I think that AIs are more important in, like, for example, producing images or like parts of like screening tests. However, physicians are always required for interpretation, and I don't really think that it can be replaced now, like just now yet. Yeah. So that is my point of view.
So I guess like, from both of your response, we won't be seeing, robot veterinarians or robot physicians in the near future. So yeah, thank you for all of your response. And yeah, I think that's it for, the perhaps more academic aspects of our interview. So, next we would like to, understand more about, your personal experiences in studying in these fields. So now I'll hand the time over to Talia.